My name is Rebecca von Lowenfeld. I'm the Associate Director of HCAP, the Healthcare Career Advancement Program. We're excited to be hosting this webinar today. And all participants are muted right now, so there will be a question answer session later on in the program. And if you have questions you would like addressed at that session, you can enter them at any time into the question area to the right of your screen. And so just enter that. And when we get to questions and answers, we will take people's questions, and also people will have the ability to raise their hand at that point as well. Our agenda this morning, we're going to hear some opening remarks about the mentorship training program, and then get an overview of the training program that has been developed over the past year. And then you'll hear specifically from our partners in Rhode Island, who were the partners in the development of this program and the implementation of this program. So you'll hear firsthand what the development was like, what the impact has been, and what people's personal experiences have been. And then we will have time at the end for questions and answers from our participants. So HCAP is a national labor management organization. Our members are unions and employers across the healthcare spectrum in 13 states. We support our partners in developing innovative workforce development projects that use a labor management approach. We also staff the National Center for Healthcare Apprenticeships, which is a national labor management partnership focused on creating standards for apprenticeships in healthcare. And to date, we have registered standards for 8 healthcare occupations. We have one more pending at the federal level, and we've been working in states across the country to really implement and expand registered apprenticeship in the healthcare space. And, to that end, HCAP was awarded a U.S. Department of Labor contract to expand industry-led quality apprenticeship with healthcare employers and partners. And through that work, we have worked across 18 states. We've got hundreds of apprentices registered in the past 2 years. We support our partners in developing the apprentice from, conceiving of the idea of doing an apprenticeship, to recruiting, to planning, to building partners, to working with education providers, so we can support our partners in all of those endeavors, and have been happy to do so. And so one of the key things we've been doing is extensive outreach. 10 states, we've supported 450 apprenticeships and 19 occupations. We've worked with state apprenticeship agencies, employers, unions, labor management training funds, and we also have the capacity to work inside and outside the unionized workforce to expand healthcare, to expand apprenticeship in healthcare. And we also have subject matter experts, one of whom you'll hear from later today in this presentation, who can really help partners at each juncture of getting these programs off the ground. As many of you know, apprenticeship is a newer workforce development solution in healthcare, and there's a lot of questions and a lot of new systems that have to be put in place to make apprenticeship work in the healthcare space. And once those systems are in place, it works and has been an amazingly impactful tool. And so our team and our subject matter experts have been able to help people really make apprenticeship work in the employer situation. And that goes from, home-based employers to large hospital employers. And what you're going to hear about today is one of the tools and resources we've been able to develop, which is our mentorship training program. And so the concept of mentorship as part of the apprenticeship is really what makes apprenticeship such a valuable workforce solution in the healthcare space. So healthcare jobs are a real combination of technical skill and soft skills, and having a mentor who can lead and provide feedback in both areas is really so valuable to the apprentice as they move from one healthcare job to another along a job career path or ladder. And so a quality mentoring relationship increases job satisfaction and retention, and really has a positive impact on outcomes. And really what we measure in healthcare is patient outcomes and patient care. And we've really seen people's satisfaction rise as the apprenticeship model has taken hold in the healthcare space. So we will dive now into our program, and we're really grateful for all of our partners who are with us on this call today. and especially to our partners at 1199 SEIU New England and CARE New England, who really worked this process through and have really reaped the benefits of coming up with it and implementing it. And so we're excited that they're on this call. And so in the call, you'll hear from workforce intermediary, the union, the employer, the apprentices, and our subject matter expert and trainer and curriculum developer about this program, how it was developed and how it's been implemented and the impact it's had. So I now want to turn it over to Amy Weinstein from Apprenticeship Rhode Island. Amy supports employers in implementing registered apprenticeship programs across all industries, including healthcare, which includes program design, connections to education, and launching a program. And Amy has been working with the partners on the ground on this program for quite some time now, and so we're excited to hear her perspective. So I will now turn it over to Amy. Do we have Amy on the line? Okay, folks, if folks give me a second, I'm going to figure out what our technical glitch is here on getting Amy. All right, do we have the folks in Rhode Island? There's the feedback. Amy, are you able to speak now?
I think, can everybody hear me now?
Yes.
Okay, great. I apologize for those technical difficulties. Let me get a little closer to our speaker. So thank you, thanks, and hello everyone. Sorry about that. Rebecca had alluded to, but before we had that pause, Rebecca had alluded to many partners in this work, and we are absolutely, sort of part of a village doing this work. It really does take a village to do this work, and we at Apprenticeship Rhode Island like to think of ourselves as sort of the convener. So Apprenticeship Rhode Island is a nonprofit organization. We're an initiative of Building Futures, and Building Futures may be recognizable to some of you as a nationally recognized pre-apprenticeship program that has placed over 250 low-income residents of Rhode Island into construction sector apprenticeships. In 2015, Building Futures was awarded the American Apprenticeship Initiative grant, and Apprenticeship Rhode Island was established to expand apprenticeships into non-trade industries, including healthcare. So we provide a kind of unique role compared to other states who have done this. Because we're a nonprofit, we serve as sort of an intermediary between our employers and nonprofit partners, as well as with the state of Rhode Island, to create and register, help employers, and provide that technical assistance to help employers and our sponsors be successful. To date, we have registered 32 apprenticeship programs, and 6 of those are in healthcare occupations, and you'll hear from some of those folks today. HCAP has been an invaluable partner to our work in healthcare. They have provided technical expertise and support. I'll talk about a little of it briefly, but probably will forget to mention some of the wonderful things that they have done for us. First of all, industry knowledge has been huge. Their experience and background with healthcare apprenticeships. They provided consulting services around program implementation. They've shared nationally registered program models to expedite the work. And we just owe our success to HCAP in so many ways for launching apprenticeship programs in healthcare in Rhode Island. So it made sense. Well, let me just say that we also, I'll just add that I'm proud to say that 2 of our programs are well underway. Our first cohort of medical assistants literally just finished their related technical instruction through Rhode Island College. And our first cohort of medical coders will finish their related technical instruction in August. And both groups will complete their apprenticeship programs by the end of this year. So we're real proud of those successful outcomes. When HCAP approached Apprenticeship Rhode Island about piloting a mentor training program, it's obvious that we were extremely eager to partner and expand those best practices. We've educated our senior labor leadership, our labor management, supervisors, preceptors, mentors, and apprentices about mentor training, and that's strengthened our overall programs, encouraged sustainability of those programs, and certainly provided a model that consistently promotes employees towards giving back to the next generation of new talent. So we're thrilled.
Great, thanks so much, Amy. I now want to introduce Jennifer Corey from Care New England, the Director of Revenue Integrity Health Information Management, who oversees this program and can speak about the impact that the program is having on the work.
Thanks, Rebecca. Good afternoon, everyone, and thanks for joining the session. Care New England is a nonprofit health system that includes several hospitals in Rhode Island. The reason for us to pursue a registered apprenticeship model in the medical coding with our labor union partner, SEIU 1199 New England, was a part of an effort to address challenges within medical coding department, including identifying a long-term plan to address vacant coding positions and a high bill hold. As a result of this collaboration, we've also changed the culture within the department to encourage professional development and involve frontline staff in the process. Our objectives were twofold. First, we wanted to reduce our reliance on contract agency staff to code our medical claims data. Contracting staff, though reliable, are very expensive and don't always share the same alliance to the organization as women and infant staff members would. Second, we wanted to reduce our bill hold, which is the amount of time that the medical claims are waiting to be coded. By reducing the bill hold, we then increase timeliness of revenue coming into the door. We use registered apprenticeship to first have you grow your own approach to investing in our incumbent coding staff and providing them with needed education and skills. Secondly, reach out to other Care New England employees who may have an interest in coding. So it was very encouraging to put the feelers out to women and infants and other staff of Care New England and take them from maybe an ESD job and assess whether or not they may be interested in coding and giving them that opportunity. So that was exciting to watch the volume of applicants that actually came to the program. The current coding staff also had the opportunity to advance their careers, and in the medical coding department within Care New England system, they could benefit from onboarding for the medical coding department within Care New England system. Another benefit would be onboarding additional coders into the long-term fold of Care New England. One of the distinguishing features of identifying and realizing the goals relied on the strong labor management collaboration through the program. As the director of the Health Information Medical Coding Department, and in conjunction with Patrick Quinn, who you'll hear from next, from SEIU 1199 New England, we received help from HCAP and the Apprenticeship Rhode Island, allowing us to set up a system of peer mentorship that was instrumental to the apprentices learning on the job and success. After the first few months of the apprenticeship and other changes instituted, the department experienced an increase in billable hours, productivity, and cross coverage. Women and Infants of Care New England looks forward to our partnership with Apprenticeship Rhode Island and HCAP and continuing to advance registered apprenticeship as a workforce solution. Thank you.
Great, thanks so much, Jennifer. And as I think both Amy and Jennifer have alluded to, this is a partnership all around. And so next, I want to introduce Patrick Quinn from SEIU 1199 New England. He's a longtime labor leader and has worked in labor management partnerships and projects both across Rhode Island and Connecticut, 1199 SEIU, New England represents hospital, nursing home, and home care workers across Rhode Island and Connecticut. So excited to hear from the union perspective what the impact of the mentorship training has been. So welcome, Patrick.
Thanks for inviting me to be part of this, and thanks to HCAPS and all the other folks who've helped support this initiative. It's somewhat ironic. There's a lot of training that goes on at a healthcare facility. There's, doctors being trained, nurses being trained. A lot of it is, academic, but there's also, a more informal system of training people to advance in different jobs and, paraprofessional and even service jobs. So it's great to actually take the next step and make this into formal apprenticeship, and we're grateful for all the support that we've gotten from all the various people and organizations that have been named here. But I guess the part I want to add is, we're just maybe a little bit over 2,000 members within Care New England. About 1,700 are here at Women Infants Hospital. The union is Connecticut, Rhode Island. We're approximately 2,800 people. Women Infants is a large OBGYN birthing hospital. It's probably in the top 10 nationally in terms of numbers of deliveries and other measurements. But, I don't need to tell anybody on this call that healthcare is changing a lot. People are being asked to take on different roles. Payment systems are changing. The length of stay is changing. Through the labor management negotiations, we've, essentially negotiated, job security for people. Very few people are not covered under a broad no layoff provision, but that also triggers, okay, well, we don't need as many medical transcriptionists as we did before because, we have various programs and things like Seri on steroids that eliminate that work or reduce that work. So what we've been trying to, grow and inculcate and develop is that you have a job, but you may not have exactly the same job, and it might not be the same set of skills, and that's part of what we have to do to adapt and grow as an organization, but also to grow as individuals and, have, career security. So there's a lot of training that happens, and we call that in healthcare most of the time precepting someone. And just being technically competent doesn't mean that you're a good teacher. So that's where the mentorship part comes in. Having someone who knows the work, but has, because there really is, a method and a way of imparting skills and knowledge to people that's more successful. And that's where the mentorship piece really helps people who are teaching, precepting, and instructing all of the apprenticeships at the various levels and areas that we're working in to be more successful. And that's something that, frankly, not a lot of people have. So adding that to a clinical or a knowledge base is really kind of like the 2 + 2 = 10 of mentorship. So that's what I would add, and hopefully that's helpful for you in understanding what's happening here. So thanks again to everyone.
Great, thanks, Patrick. And I think, to just pick up on the point that Patrick made is, training is not new in healthcare. As in most jobs, people get some type of training. And then the question is, how high quality is the training, and how long lasting is the training, and what is really the impact of having an employee trained in one way versus another way. And so I want to turn it over now to Laura Shenben, who is our subject matter expert and was key in designing this curriculum and this program in a way that really focuses on a quality program that can make sure that it's not just someone who checks in with a trainee every week and says, oh, hey, how's it going? That's great. But who really understands what it means to be a mentor and can help shepherd the program along. So happy to hear from Laura about the process that we went through to develop this and then what it is. And I see one of the questions someone has typed in is that you'd love to see samples of the mentor workshops. And so at the end of this, we will let you know what's available, but we are able to make the curriculum that we have developed available to partners across the country. So happy to share those materials at the end of this call. But I will now turn it over to Laura to just talk about how, what this is and what it looks like and how it was developed. So welcome, Laura.
Thanks. Can everybody hear me?
Yeah.
Okay, great. Well, thank you all. This has been a wonderful process. It actually started in New York with the community health worker program, which was actually a great place to start looking at the question of mentorship, because community health is really about peer education in the community, something that is happening more and more across the healthcare spectrum, where we have people with lived experience. We talk about cultural consonance. We talk about diversity in staff as well as with patients. And so this concept of mentoring, of teaching in the community, of peer learning is something that really fits. Now, we already heard from Jen, thank you so much, and from Patrick on some of the real benefits that they see, some of the real outcomes, not only of apprenticeships, which is fabulous to hear, but also this component of this mentorship component, which actually supports the success of the apprenticeship program. But for workers, and I think that's where it all sort of starts, it's being able to develop this onboarding that's clear and transparent, in which people are gaining not only the technical skills they need, but the day-to-day skills, the culture of the institution, and are pulled into the team, which again is more and more part of what we're looking at in the healthcare industry, teamwork and team cooperation in order to provide the best possible quality care. The mentorship program itself sets up a team relationship between the mentor, the apprentice, and the supervisory staff, so they're all working together with the unified objective of having these new workers who are onboarding be successful, or as Patrick very eloquently pointed out, so many workers who are in the process of changing the work they do with their current employer, the ability to really see success, to eliminate some of the barriers that people have to move ahead in their career, to be able to invest in your workforce. This mentorship has also been very helpful too. Let's move on to the next slide, which is, when we first started doing this work, and I know some of you on the phone there, I've known you for a while, and you've seen this process. When we first started to talk about apprenticeship in healthcare, people said, wait a second, that is not part of our healthcare culture. We don't do that. We do precepting. We do clinical education. We do job shadowing. We have a teamwork approach. We don't do apprenticeship. Well, it turns out that all of those things are actually, through the mentorship program, we do it. We're just calling it a little bit of a different term, but it is consistent with the culture that all of us are so familiar with, having worked in this industry for so long. The other sort of disconnect is for those of you who have been around for a while in this conversation, the role of something called a journeyman or a journey person has always been central to the development of an apprentice. A journey person or journeyman is someone who's been through training, who is an expert at it, and then takes the new apprentice under their wing. Again, not our language. We don't use it that way. But it is central to the conception of apprenticeship. So therefore, how do we translate that into a term that is meaningful to us as an industry? And while a little bit different than the way, let's say, the journeyman situation is set out, still fulfills the concept of peer support and instruction for on-the-job learning that is supplemental and supportive to the technical instruction that might happen in a school or in another venue, or to someone who is a clinical educator on specific skills. Let's go to the next slide. So the next slide is sort of this adapted element. We've talked about the core is really fairly much the same, but when we take a look at the adapted elements that we have built into this particular mentorship program, we have coaching, we include training, we have real support for new employees and incumbents making a transition into new and changing jobs. So what do I mean by real support? You know, we do tend to support people, and as I think it was Rebecca or mentioned, maybe Patrick, there's always been a lot of informal support that goes on. But here we have mentors who've been trained to understand things like different learning styles, different approaches to conflict resolution, the teach-back method, active listening or reflective listening, all of those things that really help move from an informal and sometimes successful and sometimes not support system to a system in which the mentors feel like they have tools to be very supportive. And we've heard from the mentors, and you'll hear from some of them later, about how what they learned in this program helped them to adjust their approach to the different people that they're working with in their department in ways that have led to really quite phenomenal success. And by that I mean in all of the programs that we work with, whether they're in New York or in Rhode Island, the success rate has, if not been 100%, has been as close to 100% as you can get because people are doing well and they're completing. There's also a lot of the concept of peer support itself, and we don't have time to talk about it, but there's a lot of research that talks about adult learning and the importance of peer learning and peer support. So we've built that in. And then, of course, as we mentioned before, teamwork, and then leadership development. So many of our mentors have said, I realize I can be a leader. And one of the things that does is help to internally grow your frontline leadership in ways that we are beginning to see are really resulting in improvements in quality care. I think Jen mentioned it too, the success of bringing the bill holds down in the coding department has been really phenomenal and was a success far earlier than we thought it would be. Let's go to the next slide. Next slide. Great. So what were the objectives of this program? And there's lots of things here, and I'm sure you'll get this later. But just to summarize, what we're doing here with this mentorship program is building a system for on-the-job training of new employees on formal and informal procedures. We're also building that system in a way that it works for incumbent workers who are in new or transitioning roles. For example, in the medical assistant program in Rhode Island, we had folks who were working in an outpatient maternity clinic who were already CNAs, and they were doing a lot of work that was at the top of their licensure with certification. But there's this shift, they wanted everybody to shift to be an MA. And that was challenging. But this program has made a success where if you were to have talked to people a year ago, there was a lot of people weren't sure they were going to be able to do it. And I think that there's been a real change here. So also this mentor system is part of building your internal leadership structure and an internal training structure, which creates a more nimble and flexible system within the industry, which we think has legs. You know, it may morph into some other types of work within the department or within the institution, but we think it has some real long-term impact. We've seen the successful outcome. We've strengthened teams within departments. People are getting along better, but you know, that's pretty good. There is validation of leadership development, and it also builds a reflective practice, which is, we all talk a lot about critical thinking, but what is critical thinking but reflective practice? So within the mentorship program, we have built in to that reflective practice for the mentors so that they can also carry that concept forward in the training that they do with their apprentices. Let's go to the next slide, please. So someone was asking about the curriculum. This is a really, really very short overview of the curriculum. There are 10 sessions that have been organized as approximately 2 hours, but they could be broken up differently and they could be used differently. We haven't created a script, but we've created a template. The first 4 sessions goes into the basics of apprenticeship and mentorship. And we recommend actually that for at least sessions 1, 2, and 4, that it's not only the mentors that come, but the supervisors as well, so that they are forming a team that is focused on succeeding, having success. And in those 4 sessions, we talk about adult learning, we talk about assessment, and the difference between assessment and evaluation and how assessment has to inform coaching. We talk about process assessment so that people can see their changes over time. And we talk about roles so that people are really clear what is within their role as a mentor and what is not. What is a mentorship role, what is a supervisor role? And that takes a while to be really clear. The second 4 sessions are about tools to use to be a successful mentor. So you learn something about the adult learning theory, intercultural, cross-cultural communication, and some tools for communication like feedback, conflict resolution, creative problem solving, and things like that. And then the last 2 sessions, which are generally somewhat separated from the first 8, but are an opportunity for people to reflect on what they learned, what they still want to learn, and how to plan within an institution for ongoing support and growth of a mentorship program. Next slide. So what are the outcomes that we are looking at? We have seen real quality emerge from this, and quality employees, quality work, quality teams, and we think that's central to everything. We've seen both successful onboarding of new workers and a transition for workers moving from one job to another. We also have begun to talk about, and I'm just going to throw this out for you to think about, we have an enormous issue on the horizon with retirements of RNs and needing to bring on new RNs, including new RNs who are working in new settings, particularly in community-based settings. And we've been discussing within Rhode Island the ways in which this mentorship program can actually support and enhance the kinds of preceptor programs that already exist. We have seen real internal leadership development. We have seen improved teamwork and collegiality within departments. We've seen an increased appreciation for diversity and learning differences, and that itself has been part of developing this collegiality and teamwork. And overall, we have seen this mentorship program be a support and a replication of many of the principles and components that are key to the changing culture of healthcare in our current, current situation, including this relationship between quality jobs and quality care, teamwork and critical thinking, reflective practice, and an increased appreciation of and responsiveness to both a diverse workforce and a patient population. And quite frankly, the longer we do this, the more we're seeing positive results, and the more we're seeing the potential for adaptation into other kinds of situations. I think that's my last slide, and if so, I look forward to hearing more from some of you. I think there's a lot of great work that we've done, and there's a lot of great work that still needs to be done, but we think this the situation of developing mentorship is a real strength for the industry and something that we hope will be applied more broadly.
Great. Thank you so much, Laura. And before we shift to the next part of the program, there's a couple questions that have come up that I just want to answer. So yes, we will make this PowerPoint slide available after the webinar. The webinar is also being recorded, and so we will provide a link to that recording as well after the webinar. The curriculum itself is still being finally designed, so we will have that available in the next by mid-June. So if people would like a copy of the curriculum, once it is ready to go, we are able to share that as well. So those are a couple of the logistical questions I've seen come up. And again, if you have more questions, please you can either wait and after the next session, we'll go to Q&A, but you can also type them in your question box. So now I want to, it's great to hear from the development and the process of development, but I think, there's nothing like hearing from the people who are actually part of the program, which is what we're going to do now. And I do just want to, give some context for those on the call who are not from a healthcare setting. Medical coding is how hospitals get paid. So it's highly technical, it's very important, and there's lots of specialties, and so there's lots to learn. And so people who are good coders are hot commodities on the market, and it's a very difficult skill to develop, but an important skill to develop. So this particular program at Women and Infants Hospital with coders has really been incredibly important, as Jennifer said, to the hospital itself. And we really identified this and have other coding apprenticeships going on across the country as well as a place where really a skilled quality workforce in coding is key, to the success of the healthcare institution. So with that, I want to turn over to Jessica Espinoza in Rhode Island, who is with the team of coders. And Jessica is a workforce strategy consultant with the SEIU 1199 New England Training Fund, and she focuses on apprenticeship development and implementation of this program at Women and Infants Hospital. So Jessica, we are excited to hear from the front lines about this program.
Great, well, thank you. And I'm really fortunate because I have had the privilege of working with such dynamic partners. And I think that the mentorship training program, the implementation of the pilot here in Rhode Island really speaks to the phenomenal leadership, both within Care New England, but also within the union to take advantage of the resources and the supports that have been available through Apprenticeship Rhode Island as well as HCAP to really invest in the workforce and in the future of the changes in healthcare and employment practices. So with that, we have Donna Sprague, Kathy Rickard, and Lupe Espinal, who were participants in the mentor training program and are currently mentors as well. And I think it's really valuable to hear from them regarding their experiences. So we're just going to open it up and have them talk about their role as a mentor and how it helped workers to succeed in their roles as apprentices. Donna, if you'd like to start.
Hello, I'm glad to be here. My name is Donna Sprague, and I'm a mentor preceptor for our coding department. And I'd like to say that this program has brought in a culture of change, which has allowed us as mentors to create a teaching and learning environment, which is extremely important in our field to be able to communicate that way. Kathy and myself and Leslie, who is an inpatient coder, really have come forth to take on a more leadership role to help our apprentices and coders to achieve their goals.
Absolutely. And I know Kathy has had experience as well as a mentor and preceptor.
Mm-hmm.
Yes, that's right, Jessica. My name's Kathy Rick, and I am a mentor and an apprentice in this program. One of the things I found that helped the workers to succeed in new roles is it's elevated their skill level, so they're more confident in their coding abilities. As a mentor, you become a go-to person for questions and communicating the needs of each individual apprentice to help them pass the CCS exam, as well as communicate with management.
Lupe, anything you'd like to add?
Yes, in my case, My name is Lupe Espinal. I work at the OGCC as a CNA, well, slash MA. I'm an MA now. So when we started this training, it was very challenging for us because it was a big change. Consider we all, work full time. We all have kids and family. So it was a little challenging, but with the help of the apprenticeship program and the teachers, Jessica, the union, and this mentor training that I took, I was able to help my coworkers in different ways.
So can any one of you provide some examples of how you made use of what you learned in the mentorship training program?
Sure, I can. This is Kathy. The biggest takeaway for me was an approach that we learned called the strength-based versus the deficit-based approach. For example, instead of just talking to someone and teaching them something that they did incorrectly, you would focus on what they did correctly and put a positive spin on it so that that's a model for the area that they may not be stronger in. So basically the takeaway was instead of focusing on the negative, you learn to focus on the positive, and it's been very helpful in creating a very positive learning environment for our coders.
And also, I'd like to add to that, Kathy, that one of the things we learned was the teach back, and I found that to be extremely helpful in the sense that it's one thing to be talking to an apprentice and telling them what they need to do or how they need to do something, but it's also very important that they understand what you're saying. So having them repeat back to you your instructions or your direction solidifies that they understand what you're saying. I thought that was a very good instruction to have.
Also, in my case, during this training, I can honestly say I had certain ideas of people's ability to learn that wasn't correct. But during the training, I learned different ways of teaching my peers. I learned how to approach them in a way that it was more encouraging and build their confidence. I learned that, just because you think people are not smart, I mean, you think they're not smart, but they just learn in different ways. So I learned that in the training. The training gave me the knowledge of identifying ways to help apprentices learn in their own ways.
And how about results and outcomes? Are there examples you can provide in regards to what's happened and how your role has changed the dynamics in the department as a mentor? I know in the medical coding, there was a significant shift in terms of the internal culture and the leadership that was in place prior to Jen Corey.
Well, I believe one of the things is we've been able to figure out how to provide cross-training that was not previously happening. And that cross-training has changed in the department as far as coverage, where we would not previously have had that coverage when somebody goes out or is not available. So as they become proficient in another area of on-the-job learning, they can now cover in that area.
Our productivity has increased, which led to a reduced bill hold, which has made everyone much happier. The coders have greater confidence transitioning into a different coding area. We all basically learn to cross-train into different areas for cross-coverage, as Donna had said, and it's led to a happier, team-oriented environment.
And also with that, because of the cross coverage, we've actually been able to reduce some of our contract coding in those outpatient areas, which I believe has helped the department quite a bit.
And the other thing is we are being recognized as leaders in our department for doing this program.
Also, in the MA program, since we started the apprenticeship program, our group has been brought together more. Emotionally, we became more unified. If one of us has difficulties with the subject, with anything, with the homework, we all come together to help each other. And our communication has improved more. We had a great instructor who taught us the course, but also taught us how to sensitively check in with each other as adults, working full-time jobs with families while also studying.
Well,
Great. And just if you can just get a couple more comments, and then I do want to give people time to ask some questions.
Sure, and it certainly sounds like folks have gained quite a bit from the training. Any last comments in terms of why you think it's a good program for others to try?
I've learned a lot about myself doing this program, my own strengths and weaknesses, and how different approaches can relate to an apprentice better than a different approach. I've learned how to become a reflective thinker, and I am really proud to be part of this program.
This program gave us a lot of hope. It gives us the opportunity to help in providing us with the skills that help others. The programs opens doors by showing others they are capable of doing more, whether it's learning or a new skill or maybe continuing into college.
And I would add to that and say that we've learned to bring these skills at helping our peers in our prospective places, and it's been a great experience for me personally to be a part of this mentorship training, and I've learned a lot through this process myself as a mentor and trainer, and it has helped me become a better mentor preceptor.
Great. Thank you. Thank you. And I think, what people got from that brief conversation, we'd often talk about cohort models in terms of apprentices, but having the cohort of mentors also was key here to really building the department. So let me shift now to our questions and answers and just let people know we will, they can get more information on our website, hcapinc.org. We will put this PowerPoint up. We will put a link to the webinar. And as I said, by mid-June, we'll have the training curriculum available. So the first question I think is to Jennifer, but can you speak to how the training program complied with JCAHO standards and what was needed for documentation?
well, I'd love to answer that. I think that as far as documentation, is it specific to documentation in the patient's medical record and how it complies with, coding guidelines? Can you be more specific on the Joint Commission question?
So Katie Pine, I unmuted you if you want to clarify your question.
Okay, I was typing the answer, sure. So we have a hospital that's very concerned that if they institute a registered apprenticeship program of this nature, that they won't be in compliance with whatever JCAHO standards. So they were asking us what kinds of documentation, or what do they know, or what do we know about JCAHO accepting this as ways to increase training and actually hire people into these fields as trainees.
Well, from a coding perspective, I'll take it in two aspects, I guess. The apprenticeship program itself meets all the standards that they have to meet. And that is done really kind of through the state and through the actual apprenticeship program. But as far as saying a joint commission survey coming into a hospital and whether or not that program in itself could potentially put us at risk for any kind of a survey, I would say no. I mean, we're, part of the on-the-job training, you're going through the mentorship. All the cases that get coded are going to get reviewed by your mentor. We're not going to release those accounts until they're actually reviewed, so that we've ensured that we followed all of the documentation and coding guidelines that get published from CMS, etc. So I don't feel that, having a coding program go through an apprenticeship program will put you at any risk, as long as you're setting up really kind of the layers to the reviews of those records.
This is Jessica.
Great. And just so folks on the phone know, we also are able to help as you plan your apprenticeship program, that if there is if it's for an occupation such as coding that requires certification, that we make sure that the apprenticeship matches those requirements, so that everybody has the correct certification they need to do the job. But I will unmute you again, Kate, sorry, if there was any follow-up. Does that answer your question, Kate?
That does answer my question, and I feel pretty confident that we can go back to our local hospital with this information. So thank you very much.
You're welcome.
Great. Thank you. So the next question was about recruitment. How are both participants and mentors selected for the apprenticeship?
Hi, this is Patrick, and that was a process that was worked out between the union and the hospital. We felt that it was important to take into account seniority, but we layered on top of that people would have to achieve a certain grade or mark or competency on the assessment that Littman, which is an outside vendor that does a lot of coding training and coding test prep. So we had an independent third party administering the test, and amongst those who scored well enough on that, we went in seniority order. We also had a incumbent cohort, and that cohort obviously went first, and now we've moved on to the next cohort. So we're inboarding people from elsewhere in the hospital, but we're following the same methodology, which is take the pre-assessment administered by Littman. That's an open, objective format. It's not whether you're the most senior person or whether the supervisor likes you, but once you demonstrate competency, then we revert to seniority. And we tried to take into account where we could, where people are being effectively displaced, and trying to fold them in. We've had mixed success with that, but that is one area that we're looking at, which is how do we take somebody whose job is changing maybe pretty radically or is going away completely, and how do we make redeploy them into something like this. So it's a mix of demonstrated competency and seniority.
And then I'll just add kind of how were the mentors chosen. I think that it was the three mentors and preceptors. One, they have two of them, both Kathy and Donna, have been kind of from the ground building this program up from the actual start of the conversation. So at some level, it was kind of a little bit of a no-brainer that they would be, but it so happens that also their specialties in coding are also different. So we have Donna that is really kind of in some of the outpatient coding, Kathy, who her expertise is in outpatient surgery and observation, and then Leslie, who we've brought on recently, is an inpatient coder. So when we think about our mentors, we've also kind of we've tried to cover the spectrum of the coding expertise as well.
So, and this is, I think, just in looking at some of the other apprenticeship programs that are going on and how mentors have been selected elsewhere. At the end of the day, it's really about a collaboration between management and the union, and really trying to figure out who are the right people to be in these different roles. So I know Lupe, for example, is currently a CNA, and she had gone to the mentor training in anticipation of future needs for mentors, even though she wasn't a medical assistant at the moment in time.
Great, thank you. And the next question was, do your coders work from home or at the hospital?
So actually, this is Jennifer again. I'll take that. I think that with the growth of actually the apprenticeship program going from just a conversation to actually coming to reality, with all of the growth culturally in the department and collaboration and the increased productivity that Kathy talked about, we were actually able to sit and develop a program that they could work from home a certain number of days a week. So that was one of their strong desires, was to get to that with work-life balance. And I think the apprenticeship program and the collaboration that has come from that actually helped us get there.
Great,
Yeah, the only
thank
thing.
you. Oh, go ahead, Patrick.
Yeah, the only thing I would add on that is that I guess is somewhat market driven, in that there are, there are a lot of people who code from home. So that helps us with recruitment and retention, because people who are, coding in the larger universe of healthcare often do work from home. So that gives us a market advantage, or at least meets where the market is in terms of recruitment and retention. So the union supported that, and it's a work in progress like everything, but right now it appears to be pretty successful, and is particularly important for people like say, in the winter here in New England, sometimes it's hard to get into work, and or you spend a lot of time getting into work, your commute could double because of bad weather and traffic. So that eliminates a portion of that annoyance.
Though I would have one follow-up comment, and I apologize, for training purposes. So when there is actually training that is going on, the coders are actually on site. So training does not occur remotely.
That's a great clarification. And then just so people know, there also was a coding apprenticeship in California where the coders were home-based coders. So this model can work either way. The next question is, how much time can a mentor expect to invest for training?
Do you want me to answer that question, Laura? This is Laura.
Sure.
Sure, Laura. I think if you want to reiterate the time of the actual curriculum, and then maybe the folks in Rhode Island, was there additional time investment just in terms of their own growth? So I think we can take that from both angles.
Okay. So the training that we set up for the actual mentor training itself is about 20 hours if you were to do the whole thing. It can be done over time. There's lots of different ways to do it, and some of it can be reduced depending on other training. But let me say that in terms of the amount of training time that people do, we've been focusing a lot on the coders because it's a very advanced program in Rhode Island. But I also, want to say that this is happening with MAs, and there's a very advanced program also in New York with community health workers. And the amount of time and the way in which the actual training of between the mentors and their apprentices is really structured differently depending on the particular occupation. So I just want to put that out so that you understand that what you'll hear is very particular to a very successful model of coding. But if you were to look at another occupation, you would have a different answer.
Got it. And I know we're running short on time, but I do want to turn this question over to the folks in Rhode Island in terms of just investment of time, if there's any comments on that. And then we've got one more question, and then we will wrap. So Jennifer, or any of the mentors, do you have any comments on sort of the investment of time?
Well, I think this is Jennifer again. I think it is a significant amount of time. We're trying to plot out some of that now. If we think about, and again, this is coding specific. So I'm sure that different apprentices are different and have different amounts of time. But, we're we're sitting there trying to plot out now for the inpatient coding portion of it. And if we say that we want to have them do 600 hours of on-the-job training, you know, what is that going to translate between the actual mentor who trains them? Is it the first few weeks, it's, you know, one-on-one, and then after 3 weeks, it rolls to, you know, 4-hour mentoring while they're doing their own independent coding, and then further down in the weeks, you know, 8 to 12 weeks, it may be a little bit less. So, I mean, I think that, you know, when we were looking at bringing about 4 or 5 people through the program, we found that it was about 526 hours, I want to think. I mean, it's a lot. It depends upon, I think, the discipline that you're talking about.
Yeah, and inpatient is.
And inpatient requires
a lot.
Yeah.
And
So-
it's been really helpful to work with Apprenticeship Rhode Island and HCAP to tease through within different disciplines what may work and what may not. So in some scenarios is one-on-one mentoring needed in terms of the on-the-job learning, but is there flexibility in other scenarios to be close by? So for example, with the MA, having nurses be mentors, where you don't necessarily need one-on-one shadowing, but they're accessible. And I think, you know, HCAP and Apprenticeship Rhode Island have done a really great job in working through joint apprenticeship training councils with the union and management to try to figure out what makes the most sense in the different occupations that are being discussed.
Great, thank you. And then I will get to our last question. I do just want to put up, this is my contact information. So if people have additional questions, I can put you in touch with all of the speakers on the call if there's follow-up. And again, if you would like any services we are able to help offer, we can help people conceive of and implement apprenticeship programs or mentorship programs. We're able to do a train the trainer session on the mentorship training if that is something that would be helpful, and we can just consult. And as you have questions about what this might look like in your workplace or on your program, we're happy to give that assistance. And then, as I said, if you would like a copy of the curriculum, please do email me and we can get that out to you. And then, and before I do the last question, I do just want to thank all the presenters for their time preparing for this webinar and for participating. And so then the last question is, in regards to recruiting, how did you overcome resistance to taking on this additional work when shortage in staffing was already an issue?
I don't know that we really actually experienced resistance. I have to say, I think from the get-go, we were ready to roll with this. And I think that just, you know, the fact that you had the vacancies and you really couldn't fill, you know, drove people's enthusiasm on, you know, taking partnership in it and moving it ahead. And I also think in the internal cohort, it became this huge education opportunity that they were really, really looking forward to. So once they got excited about that, the excitement just continued. Again, that is, you know, on the coding side of things, I don't think we really met any resistance.
Yeah, on the coding side, I think we skipped over it because it was, you know, something that we have already internalized, but there was a major shift from ICD-9 to ICD-10. And then we're a specialty hospital here at WNI, so there's not a lot of people. To the point that Jen was making earlier, we would get a contract coder who we'd pay a lot for, but then we'd have to train him or her in all of the nuances of our, you know, case mix. So we were training somebody that we were paying. It was like, what, you know, this is no brainer. We need to train our own people. And then with respect to the MA piece, and I'll let Lupe add if she wants, but this was basically kind of like, the OGCC is an ambulatory clinic for people who don't have, you know, an OB doc. So think of it as a large, you know, community health center style clinic. There, the hospital wanted to hire someone into an MA job where the cohort was primarily CNA. And, you know, the union frankly pushed back on that and said, that's not going to work in terms of the operationalizing it, because if that person's not there, then nobody else has an identical scope of practice. It's going to unravel. It's going to be complicated. It'll mess up simple things like, you know, personal days, vacation days, leaves of absences. If people aren't all trained to the same standard and scope of practice, it's not going to work. So, you know, thankfully, the hospital recognized that, and the employees, you know, embraced it because it's, you know, career development, and it also, you know, is a pay increase because, you know, we're upgrading their skills. They're going to get a wage bump. So there wasn't a lot of resistance there either. So, Lupe?
Yes, at the beginning where everybody was nervous in the department because it was a brand new thing that we were studying. And the fact that we have to study and have quizzes every week. I mean, we're all mothers, we have kids and we have families and work 40 hours a week. It was very challenging, but we are successful now. We completed the MA course already. Just the class part, not the on-the-job training. But we're all happy. As a matter of fact, we're going to go out tonight to celebrate.
Very good.
Thank you. Thanks so much. And I do just want to close there and thank all of the presenters and all of the participants. And again, please do contact us if you have any needs or need any support around registered apprenticeship or mentorship training, and we will get these materials out. And then I think just the last answer on that last question in terms of the lack of resistance really was what you heard on this call, that this was a partnership, the employer, the union, the workforce development agency. And so when you build these programs as a partnership and as a labor management partnership, you really can overcome some of the issues that may happen in just a regular employer implemented training program. So with that, we will thank everyone again for their participation, and everyone have a wonderful afternoon.
All right. Good job, everybody.
Yeah.